Hello friends, welcome to the Viva Voce of Anatomy. Today's topic is the ulnar bone. Now the ulnar bone is a bone of a medial side of the forearm and it is homologous with the fibula of a leg. Now it is an example of a typical long bone. So it will have upper end, shaft and lower end. Now we see the side determination. The upper end is hook-like with the concavity of a hook is facing anteriorly. Second, the sharpest border, intrussus border, is facing laterally. The styloid process in the lower end is facing posterior medially. So the given bone in my hand is of a right side. Now we see the feature and the attachment of the ulna. It is divided into three parts: the upper end, shaft, and the lower end. So first we will see the upper end. Upper end of the ulna is having two notch and two processes. First we will see the processes. Its first process is a olecranon process which is facing apart from the upper end of a ulna. Now the olecranon process is having the five surfaces that are anterior surface, posterior surface, superior surface, medial surface and the lateral surface. The anterior surface is articular and it will form the upper part of a trochlear nose. This will articulate with the trochlea of the humerus to form the part of a elbow joint, which is a hinge variety of the synovial joint. Second, the posterior surface. The posterior surface is in form of the triangular area. It is subcutaneous and separated from the skin by a bursa. The third, the superior surface. The superior surface is rough in its posterior part, which provides the insertion of a triceps brachii muscle, and its margin provides attachment to the capsular ligament of an elbow joint. Now the tip of the superior surface will form the point of an elbow, and this tip lies in the same line with the medial and the lateral epicondyle of the humerus in the fully extended position. And the tip will form the 3-point bony prominence when the elbow is flexed. Now the next surface, that is medial surface. The medial surface of the olecranon process is continuous below with the medial surface of the shaft. And the last, the lateral surface. The lateral surface is continuous below with the posterior surface of the shaft. The lateral surface along the margin will provide attachment of a capsular ligament of an elbow joint and the two bend of a ulnar collateral ligament. Second process is a coronoid process. Coronoid process is a bracket-like process. It is facing anteriorly from the upper end of a ulna. It is having the four surfaces. The first, superior surface; second, anterior surface; third, medial surface; and fourth, lateral surface. The first, the superior surface. Superior surface is articular and it will form the lower part of a trochlear nose. It is articulate with the trochlea of the humerus to form the elbow joint. Second surface of a coronoid process, the anterior surface. Anterior surface is a rough triangular surface and its lower part it will form the ulnar tuberosity. The anterior surface will provide the insertion of a brachialis muscle. Now the medial margin of the anterior surface is sharp and in its upper end it will show a tubercle which is known as a sublime tubercle. This medial margin of an anterior surface provides attachment from above downwards, the origin of flexor digitorum superficialis muscle, ulnar head of a pronator teres muscle and flexor pollicis longus muscle. Now talking about the third surface, the medial surface. The medial surface of a coronoid process is continuous below with the medial surface of the shaft. The last surface is a lateral surface. The lateral surface, in its upper part, it will present the radial notch. This radial notch will articulate with the head of a radius to form the superior radio-ulnar joint, which is a pivot variety of a synovial joint. Now its anterior and the posterior margin, radial notch, will provide attachment of an annular ligament. Now the second part in the lateral surface, below this radial notch, this lateral surface will present the one fossa or a depression which is known as a supinator fossa. Now the radial tuberosity of a radius will accommodate with this supinator fossa and provides the free movement of a superior radio-ulnar joint. Now behind the supinator fossa there is a sharp crest. This crest is known as a supinator crest. Now the part of the supinator fossa and the supinator crest will provide origin of a supinator muscle. Now we see the second part of a ulna, that is the shaft. The shaft is triangular in the shape. It is said to have 3 borders and 3 surfaces. First we will see the borders. It is having 3 borders, that is anterior border, posterior border and the lateral or the introsus border. The first we will see the anterior border. Anterior border will extend from the medial margin of the ulnar tuberosity above up to the base of a styloid process. Anterior border in its upper 3/4 give origin to the flexor digitorum profundus muscle. Now the second border, that is the posterior border. The posterior border is extend from the tip of a triangular area at the posterior surface of olecranial process and extend up to the styloid process. Now the posterior border is subcutaneous throughout and you can palpate in your body. Posterior border gives origin of a 3 muscle by a common aponeurosis. These muscles are the flexor digitorum profundus, flexor carpi ulnaris and extensor carpi ulnaris. The last border, lateral border. The lateral border is the sharpest of all 3 borders. It is also known as introsus border. It will start from the supinator crest above and it will extend up to the head of a ulna bone below. It is ill-defined in its lower part. This lateral border in its lower 3/4 gives attachment to the introsus membrane to form the middle radio-ulnar joint, which is a syndesmosis type of a joint. Now we will see the surfaces of a shaft. It is having the 3 surfaces, that is the anterior surface, posterior surface, medial surface. First we will see the anterior surface. Anterior surface lies between the anterior border and the lateral border. Anterior surface in its upper 3/4 gives origin to the flexor digitorum profundus muscle and in its lower 1/4 give origin to the pronator quadratus. The second surface we will see, that is medial surface. Medial surface lies between the anterior border and posterior border. This one is medial surface. Medial surface in its upper 2/3 part give origin to the flexor digitorum profundus muscle. The last surface is the posterior surface. The posterior surface lies between the lateral border and the posterior border. Now the posterior surface is divided into 2 parts, the small upper part and the large lower part, by an oblique line which is passing from the posterior margin of a radial notch up to the posterior border. Now the small upper part provides insertion of an anconeus muscle. The large lower part now again divided into the lateral part and the medial part by a vertical ridge. Now among these 2 parts, the lateral part will give origin to 3 muscles from above downwards. These are abductor pollicis longus, extensor pollicis longus and extensor indicis. Now we will see the last part of ulna, that is the lower end. The lower end of the ulna is having 2 parts, the rounded head and the styloid process. The rounded head along its lateral part of a rounded head is convex and it will articulate with the ulnar notch of the radius to form the lower or inferior radio-ulnar joint, which is a pivot variety of synovial joint. The styloid process is directed posterior medially to the head of a ulna. Now, at the posterior part, between these two structures, between the head of ulna and the styloid process, you can see one groove. This groove will lodge the tendon of extensor carpi ulnaris.